everybody. I am Cynthia Turner, your host, and I have a guest here. Her name is Miss Darlene Cypress, who is the director of a program that she directs services, shall I say. She is in a supervisor position, and she knows a lot about what we're about to talk about. But first of all, I want to say thank you to Brick and all the executive staff for allowing me to present this presentation with truth, honesty, also education. When we talk about health, illnesses, resources, anything that life may bring to you, that's what I talk about. And the name of my show is Resiliency, and how people bounce back from a whole lot of life experiences, trauma, tragedy, whatever you want to say. And the guest tonight is here to talk about substance abuse and how it affects us as a people, young and old. So, Miss Cypress, thank you for being on the show. You are truly an inspirational woman. You are a phenomenal woman. I knew you for a couple of years, quite a few years, and you have been nothing but a motivator for me. So tell me a little bit about yourself, and how did you actually get into substance abuse?
That's a long story because I've been for years. I've been in substance abuse treatment. One of the things is that I was also a drug addict, a crack addicted person, and an alcoholic, and that also motivated me. But when I got into it, then a lot of other things happened that followed that. So it kind of inspired me to do more, help out those people that had mental illness and when they were crashing off of crack, then they were being diagnosed with mental illness because it had the same signs. So it motivated me to want to be a counselor, to help other people.
So you said when they were crashing off a crack. What do you mean by that?
When you are smoking crack, it takes you to a high. And then when you come down, you look like you're depressed. You look like, you can't sleep. You're itching.
Doesn't that happen with all drugs?
No, not all drugs.
Really?
All drugs. Right now we're dealing with a fentanyl problem.
Mm-hmm. Yes.
And it's killing people.
Yes, it is.
Because they're putting it in everything.
Okay.
The only thing I haven't heard it being put in is alcohol. It's on crack.
Next, huh?
It's in PCP, K2. It's in cocaine.
Okay, so when you have you call them clients, right?
Mm-hmm.
When the clients come for services,
Yes.
and they're under the influence, what is the first step that you take?
To do an assessment, a full assessment, which means medical, psychiatric, as well as the substance.
So if they come to you under the influence, will you still accept them and do an assessment?
It depends. Basically, you have to see if that person is stable on medications, if they're psychiatric, because sometimes you can't reach them for substance if they're not stable with their psychiatric.
Okay. So
it could be a problem.
So how about if you have an individual who has mental health, right?
Mm-hmm.
And they're not taking their medication, and they haven't taken their medication. However, they're continuously using substances. So, and they say, oh, well, you know what? No, I don't have a mental health. I don't take medication. But you come to find out that they do.
Yeah.
What is the outcome in that situation? Because it happens a lot.
It does. It really does. And we end up having to usually send that person to be stabilized in a hospital-based program.
Emergency room, preferably?
That's
Detox?
the first one, the psych emergency room.
Okay.
And then if admitted, they can stabilize them on their medications. Mm-hmm.
Okay, so if the individual is diagnosed with a mental health and they come to you and say, for instance, they've been stable for a couple of days, they haven't used any drugs, but they know if I don't get treatment, I'm going to use again. Would you accept them?
It depends. Because I'm not the only one, or other people are not the only ones that make that kind of decision. So a team effort. And that's where the decision is made.
Okay, that makes sense. So how long have you been into substance abuse and mental health?
Long time.
What's so long? Because
over 30 years.
Very knowledgeable.
Over 30 years.
Okay.
It's really hard right now because I don't know if you know, they're doing a lot of harm reduction.
Yes.
And and they have places where they can actually shoot up
and use
safely.
Different types of drugs.
Yes.
Quote unquote safely. Exactly. So if you have harm reduction, right, in one place, and you have treatment in another place, and you have an individual say, I can use safely. They'll give me clean needles. They'll give me condoms. I can sleep here for 24 hours and take a shower and go back in the street. What do you think they're going to choose?
Of course they're going to choose to use and dwindle down. But is that really helping them?
Well, I would think
scary. It's very scary.
I think for the most part, it would be eliminating the factor of that they may shoot dope all day long, as opposed to maybe a half a day. And then, okay, maybe the next day they may go back to an ounce or quarter, whatever they may be using. But in the back of their mind, they say, you know what? I'm going to go to Ms. Cypress' program because I was there before and I know I can get some help when I really want it. And people it's not about will anymore. It's about self-preservation, right? And having the desire to stop using. Because people can say, oh, I have the desire to stop. And most of the time they stop. When they have the will, they think, oh, this is willpower. I don't believe in willpower when it's a life and death situation. Do you?
No.
Okay. Have anybody ever overdosed? Have you seen them? Did you see anybody overdose?
No, I've not.
Never witnessed the overdose?
I've never seen that.
That's a blessing.
But yeah, it's truly a blessing. But I've had people tell me, clients particularly, saying that they've overdosed 10 times and they still use it. And it just breaks my heart because you would think because of that, they would say, that's enough. I don't want to die. God done brought me back how many times? It's time for me to quit. But it doesn't happen that quick. And it doesn't happen all the time like that.
Well, you know, from living in Brooklyn all my life, having family, friends, as well as myself, utilizing substances to the point where I became homeless and jobless and penniless and all the other kind of stuff that goes with addiction. Because when I was using, right, we didn't really have programs to help us until a certain organization started say, you know what, well, why don't we try to help these people? You know, you got Oasis, you got rehabs, detox now, self-supporting programs. And I think when they realized, especially after the AIDS epidemic, right, people figured, okay, well, if we give them some clean needles, maybe we won't have as many deaths. And statistically, it actually worked. Because where you would have 800 people dying in a month, you now have maybe 600. So it was actually working. So I think harm reduction is real important. And a person is not going to stop using until they're ready to stop. And it's unfortunate, but some of us has to die in order for some of us to live, right? Because the addiction is a horrible way to live. It's a horrible way to live. And we don't even know sometimes why people use. You know, death, sicknesses, illnesses. Because some people get sick and they have surgery and the pain is overwhelming. They turn to medications and they get addicted. Lose their house, their homes, and people think, oh, well, she just don't want to work. Oh, she just a drug addict. Oh, he just shoot dope and he getting welfare. People don't know people's story.
That's right.
So I also, exactly. So I am also in the field, right? I have substance abuse and mental health. And my journey also began because I can give back. And a lot of clients, I'm quite sure you can attest to that, understand that we understand, so they be more susceptible to saying, you know what, I can talk to her. I can tell Miss Cypress probably anything, and she'll know exactly what I'm talking about. And maybe one day I will stop. And when we use motivational, inspirational tactics, right, which means we communicate with them. We don't tell them what they should do. You should stop doing this. You should. No, we can't. So when you use motivational interviewing, I think it helps a lot.
Yes, it does.
So how you said how long have you been drug free? You mentioned you had a history of substance abuse.
Over 30 years.
So you've been clean out over 30 years.
Over
That's such a blessing.
Mm-hmm.
So did you start immediately once you got clean?
When I got clean,
when you stopped using drugs, made a decision that you wanted to go into social service work.
It was a definite must. But I didn't know how to get out of that trap, man. And I remember I was smoking crack, and I was thinking, God, if you don't help me, I'm not gonna get no help. And I remember being pregnant and still trying to smoke. And I said, Lord, please don't let this drug get in my baby. He didn't ask for this. And I remember when I had that baby, they tested me.
Yeah,
I never saw a doctor, no prenatal. And when I had that baby, they were talking about me to my face on that, because I'm a C-section.
They who?
The doctors. And they tested that baby. There was nothing in that baby.
And you were smoking the whole 9 months?
Yep. And they let me take that baby home.
So that's your miracle baby, huh?
That's my miracle
and
baby.
Is that when you stopped using?
No.
Okay.
Went back to using again.
Okay.
I think the day I went home, it was such a grip on me. What happened was when Jesus said enough is enough, you're my child, he snatched me out of that clutch. And I'm so grateful. So every day I thank God. And I know it's God through Christ Jesus who helped me.
Amen.
So sometimes I got people that I see struggling on drugs that are evangelists, that are deacons, and they've been hurt so bad. It's trauma-based.
It is.
It's trauma-based. So if we could get, and I tell them, don't come for detox and don't do rehab. Because you are just taking the toxins out of your body safely. But you ain't dealing with why you doing it in the first place.
Exactly.
You need that help.
Absolutely. Because, people always, well, in my experience, people tend to judge.
Yeah.
Again, you may see my glory, but you don't know the story.
Oh, I like that. I like to sing.
I appreciate that. And when people, let me say for me, when I see someone using, because I see it every day, it's pandemic ain't going nowhere. It's still here. The drug pandemic is still here. That's right. And we don't know what caused that person to use, because a lot people use to feel better. About a lot of experiences.
And they self-medicate with the substance for their psychiatric
because
issues.
Well, that's dual diagnosed, first of all. Because a lot of people
Definitely.
don't use drugs that have mental health, and some people that have mental health don't use drugs. So they can have one or the other or both, right? I'm quite sure you deal with MICA patients all the time.
Yeah, all the time.
So the underlining is that doctors, specialists, do they deal with the underlying issue, or somebody comes in there intoxicated, they drunk out their mind? Oh, he's just drunk. Especially a patient that you used to seeing him. Oh, he always here. Oh, that's Joe. He gonna be back next week. Have you did a thorough examination? Have you did a thorough, comprehensive psychiatric evaluation? Did you find out the core of his alcoholism? No. You just know him as Joe the drunk. So I kind of take that to heart, because if you have somebody of the other nationality, oh well, you send them upstate in the woods so nobody see their darkness. But us, we exposed to everything. Like we ain't nothing. We ain't cry. We ain't. You see the other day, right? The neighborhood in Bed-Stuy, they coming in just like us. black, blue, green, white, orange, yellow. It don't discriminate.
No,
so when you was up in the suburbs, or what you call that the high class area, the hills, or whatever you want to call it, the Hamptons. You ain't in the Hamptons no more, because I see you around the corner from my house.
All right.
So addiction is worldwide. It attacks everybody.
It is.
Only difference is we just be exposed more, and then they use it. They're using. They end up in jail, right?
Yeah.
Fighting, losing jobs, don't take care of their families. So it's really, really sad. And the bottom line is, what do we do? You got the government spending all this money on all these high-rise buildings, financing carpenters and all this construction, and you still got thousands and thousands and hundreds of thousands and thousands of people still in the neighborhood who are homeless. So why you think they're gonna stop using drugs? They're medicating. They're suppressing.
Yep.
And in other words, we're still being lynched. They just say hanging us from the tree. So I really have a concern, for that. And what do we do? Do we just talk about it? Because I know this young lady, on my way to work, I used to take her clothes. She's sleeping at the bus stop in Cypress. And she been there for years. I'm talking about years. For years. And I passed her on my way here. And I just pray, like, God, when is enough going to be enough? So it's really heartbreaking and heartfelt when we have the drug pandemic and it ain't going nowhere just because they move from one spot to another. Is it really getting better? What are the grants for that you throwing into businesses that's opening up all around the people, that you opening up your store, but you got the man sleeping on the floor right there. You can't even get in the door unless you tell him to move out the way. What about that? But then when he run in your store and steal, you want to call the cops on him and have him locked up. So what are we doing? What are we doing?
A lot of prayer.
So I know that prayer without action is
dead.
So
works without.
We can pray,
That's right.
but we have to participate in something. Like I will go to shelters and feed the homeless and things like that. One of my girlfriends, we would go on Sundays and feed the guys in the shelter, the women in the shelter, take them clothes, whatever. But that I don't think that's just enough, because a lot of times they're institutionalized, just like jail.
That's right.
They institutionalized in shelters as well.
And shelters is a toxic environment.
They are. But you know what I found about... They're not really doing
nothing in the shelters to stop anything either.
But you know what I found out about the shelters? It's a certain category that you have to apply yourself to. Because I've seen a lot of success stories in the shelter. I worked in the shelter for 14 years, and I've seen many success stories.
Good.
Maybe because it was a drug-free shelter. However, they had to make a choice to stop using. Because we didn't deny them when they use. Right? So I just want to say domestic violence goes hand in hand with substance abuse. You think?
Oh yeah, I've seen a lot of that too. Human trafficking.
Under the influence of substance abuse, people commit a lot of crimes. They're insensitive. They are desensitized. And domestic violence plays a part because you don't have that love and concern and consideration for your partner. People think it's just women getting abused. No, it's men too.
It's not. You're right.
And I think the men don't say anything because of the masculinity.
That's right.
I'm a man. I got balls. I ain't gonna tell nobody she beat me up last night.
I ain't going to the go.
Or because, you know what? I'm not gonna hit her back. I'm not a woman beater. But they'll take the abuse. It's still not right. No, domestic violence is domestic violence. Yo, the guy walking down the street with scratches on his face and all that. Like, really? Just leave. And it's easy said than done sometimes for men and women, because we don't know, what that man went through. We don't know what the woman went through, but we know it exists. And the question is, what do we do about it? Funding, building low-income houses. Where are they? Low-income houses where? Because I went and looked at a one-bedroom the other day. They wanted $2,500.
What?
And the lady told me, I said, well, $2,500 for what? She said, oh, well, you got a dishwasher, You got a dryer, and I said I can go laundry wash my clothes.
Mm-hmm. Probably cheaper.
So they building this environment up, but not for us. Still bringing us down. So you think the girl that's sleeping on the bus stop gonna say, okay, well, I'm gonna get up and try to get me, a job or apartment for what? I can't pay the rent.
Exactly.
Probably don't even have an education. So we gotta start from there, right? What you can or what you're not capable of, in order to change society and the way they think about us and see us, right? Because all the buildings I see going up, out of 1 million, you may get 20 of us in there. And then you got different exodus. I going this way, you going, how is that? We live in the same building. I've seen it. So that's a concern for me. So Ms. Cypress, I just want to say thank you for sharing your expertise in this area of substance abuse and what you've seen, how you got there, and how you're going to help people. So in closing, I'd like you to just briefly let people know what resources is available, what they can do. You talk to your audience and let them know how they can get some help. Real quick. You could talk to them and let them know.
First, you have to come to the end of yourself.
Okay.
You must seek out, and there is help available. There is a hotline. You can Google help. I've seen a lot of family members when their loved one goes into the hospitals for detox. The social workers are there to help and to get them in placement. There's residential programs. There's also outpatient programs. But if you can't stay clean in the outpatient program, there are other places to go, rehabs, detoxes, and they're all over. And everybody's worried about how much money is it going to cost me.
And for domestic violence, what do you say about domestic violence? What should one do to hopefully save their lives? Because we don't want to put people in danger. Because if I see my neighbor getting beat up and I know her boyfriend always beats her up, I'm not going to call the cops because he may kill her. So anonymously, we can make decisions to get some help for people.
Especially if you're a mandated reporter.
Right.
You have to call.
Okay. So my name is Cynthia Turner, and I am the host. And my guest, Ms. Darlene Cypress, she's just a pleasure. So guys, girls, men, women, you got some insight. You got some information about knowledge, where to get some help if you need it. Because domestic violence, substance abuse seems like it's not going nowhere. So first and foremost, we still have to love one another. All right? So let's just try to care about one another no matter what, and hold your head up and stay positive. So Ms. Cypress, I just want to say thank you for coming and sharing your experience.
Can I say one thing?
Sure you can.
I really think that people need to put God in their life. Okay. A lot of times that's a missing piece.
Absolutely.
And if they don't have God, of course they're going to look for other things, trying to search out to fill that empty void.
But you also know, right? Some people are angry with God because of experiences. So we can say, okay, you need to seek God, but first and foremost, a person has to make a decision that I want the help. I need to start loving myself. And eventually, because if you don't make a decision to say, you know what, I need to stop doing what I'm doing, ain't no way you're going to love God, because you don't even love yourself.
True.
So you got to ask for the strength.
Yes.
Right? Well, and then everything else falls into place. Prayer. Absolutely. Some people don't know how to pray. Well, but anyway.
There's always a place to go.
But you heard Miss Cypress, right? She said ask for prayer. That's all you got to do. Put one foot in front of the other, and you be well on your way.
That's all
so thank you, Miss Cypress. That's all you got to do. Pray your day away.
All right. That's
and
so
the pain.
True.
So I just want to say thank you.
Thank you for having me on your
and
show.
You such a pleasure, Ms. Cypress. I appreciate you.
And
hopefully I'll have you back again one day.
I hope so.
All right, because I know you got a lot of stuff going on. Absolutely. Absolutely.
So true.
And you look so fabulous.
So do you.
I appreciate you.
Yeah.